Well, there's a new warning about the dangers to our health from alcohol. The U.S. Surgeon General, Dr. Vivek Murthy, sounding the alarm on the link between alcohol and cancer. He's now urging Congress to update warning labels on alcohol bottles to highlight the risk. The Surgeon General also calling for a fresh look at government guidelines on just what safe alcohol consumption is. Is one drink too many? Let's bring in Dr. Devi, New York City physician specializing in pain management, associate professor at NYU School of Medicine. Dr. Devi, always good to see you. The first question is, because a lot of people are wondering, gee, I drink. How much is too much? Should I stop? Do I need to curb? You know, what's all this about? Why this new warning now? And how bad is drinking alcohol?
Well, these are all good questions. I mean, the first thing is the harm, right? So we know that alcohol, even one drink, if you have alcohol, it gets digested in the body, it gets absorbed and broken down. And one of the breakdown products is acetaldehyde, which is a toxic chemical. Now, usually the liver can manage that, but the more that you drink, the more acetaldehyde you face. So that itself can be cancer-causing, but at which point certain people might develop cancer is a little bit less clear because cancer is more complex with a lot of different factors. Then alcohol also can affect hormone levels, so it can cause estrogen to increase. Estrogen is often associated with breast cancer, so that's another complex relationship. And finally, alcohol, you know, just what it comes in contact with, like in the head and neck and the throat, it can also make you more predisposed to developing cancer in those areas, especially if it's combined with tobacco. So there are harms, but the picture is a little bit more indirect and more complicated depending on the type of cancer that you're looking at or talking about.
Yeah, they say there are links to potentially 100,000 cases of cancer a year and 20,000 cancer deaths. You mentioned, well, there's breast, colon, esophageal, liver, you know, mouth, throat cancer, voice box cancer. You know, how do we know if we're drinking too much? And should people stop? Or, you know, we always were told moderate drinking is good for your health.
Well, so this is also kind of complicated because the warning label would be on all alcohol, but as you pointed out, you know, the results from past studies were kind of mixed. Like people thought that drinking red wine could be healthy. So I think one of the conflicts will be, I think Dr. Murthy is right that we should look at this again and maybe modify the government guidelines, but I don't think it's as clear as putting the warning label on all alcohol because what you want with a warning label is to have a very clear message. So, for example, when they said that, you know, tobacco could be linked to lung cancer, all healthcare providers and generally the public after mass media campaigns, everybody was kind of in agreement about that. But with alcohol, if a patient goes and asks their doctor about it, they might get mixed messages depending on their individual risk factors and stuff. So I would say the first step would be to educate healthcare providers and really look at what are the best studies on this topic and what should we really be saying.
Yeah, we heard a lot about. I remember the resveratrol, which was in red wine. Everyone was on a big kick about that, drinking red wine, saying, you know, it's good for your heart. It may not be now that we know more. So what would you advise people to do? I mean, back in 1966, they put the warning labels on cigarettes. That seemed more direct. You know, how exactly direct is this? If you know, is it better to drink beer or wine, or you stay away from the hard stuff if you do drink, or, you know, quit?
Well, so when we're talking about cancer, it depends how much you're drinking. So if you drink enough wine, that could be as harmful as drinking very little of the hard stuff. But what we've noticed since the pandemic, there is some research that there's a disparity forming. So some people stopped drinking during the pandemic. Some people actually went the other way. So if they were heavy drinkers before, they started drinking more heavily. So those folks would probably be the ones that are more at risk. And I would say people, I agree that most people may not realize that there's a relationship between alcohol and cancer, so it is worth talking to the doctor about it, especially primary care physicians who usually do ask about alcohol-related habits and stuff. But in terms of warning label, I think it's, you know, it's a restriction on free speech, so it can create the wrong message. If people see that, get alarmed, and then it's not really relaying kind of the proportional risk for each person in terms of developing cancer from alcohol. So we don't want to increase the public's distrust again.
All right, but still be careful. I guess you got to think twice before we start stirring the ice.
Of course, especially if you take any medications or have any other medical issues, right?
That's true. That the dangers of alcohol are real. Dr. Devi, good to see you. Thank you so much.
Great to see you.